A key emphasis of NextGen is to integrate the bench research to bedside translation.
Currently, it takes almost 20 years for new medications, new compounds to become therapeutics or the standard of care in the clinic. We will have the opportunity here at NextGen to accelerate that by having both basic scientists and clinical trialists under one building.
We wanted to really move discovery into the next generation, and we wanted to bring some of the amazing scientific findings to bear on the healthcare problems of Missourians. And one of our strengths at MU is the MU Research Reactor, which makes radionuclide drugs and radionuclide biomarkers for diagnosis of various diseases.
This very important project will interweave all of our schools and colleges, as well as MU Extension, MU Healthcare, and the Nuclear Research Reactor, so that we can realize the full benefit of research and training, as well as engagement in precision health. We're so proud to have so many colleges and schools that represent the very best faculty members who compete nationally and internationally. Among our faculty, we have members of the national academies, as well as a Nobel laureate in chemistry.
We have unique interdisciplinary resources for large and small animal models for biomedical research. NextGen is going to take our bench-to-bedside process to the next level.
It's not common that you find research buildings really this close to a hospital, which means that clinician scientists can come here and work with the basic scientists.
The scientists that work at the VA hospital and that work in MU Healthcare in the School of Medicine are often the same, and they do half their job in one environment and half their job in the other environment. It's all integrated. You can't do next-gen precision health without the MUHC, School of Medicine, School of Nursing, School of Health Professions, and other health professionals.
Each of these teams that are working on different diseases are working all in a big shared space and learning about the solutions that are being used for one disease and then how it may translate and be useful in another disease. That means for patients, diseases that were chronic and progressive may now be able to be arrested or even cured.
Our federal and state elected officials believed in our vision to create this innovative center that will advance our mission as an AAU research institution and to serve the health needs of Missourians throughout this great state.
The NextGen Precision Health Building is a cornerstone of our commitment for reinvigoration for research excellence.
We utilize a number of approaches that go all the way from cellular models to studies in isolated vessels, studies in animals, as well as studies in human subjects through clinical trials.
It allows for people to not only recruit patients to the hospital, but to be able to have clinical trials working with them. Just the proximity, it fast tracks our ability to get more patients in here that would otherwise not be able to get. We can answer our questions more quickly, and ultimately, with speeding up the whole process, is we can identify treatments that we can get to the population more quickly.
I am a researcher, but above all, I am a physician, so my ultimate goal is to improve patients' lives. And discovering and researching new therapeutics definitely make an impact on that.
We've added 2 new partnerships that exist in this building on the day we open, and those are the partnerships with Siemens and Thermo Fisher. On the Siemens partnership, we're imaging whole organs. On the Thermo Fisher partnership, we're imaging cells and molecules.
We are getting a 7T MRI, which is the highest field strength MRI used for clinical patients.
As a result of that Siemens partnership and bringing in equipment like that, we are getting contacted by imaging researchers throughout the country that want to come here to Columbia, Missouri to be able to use this piece of equipment to further their precision imaging research.
We are committed to hiring the very best and providing the resources for them to succeed.
When you can take research into community and partner with them and have them have a longer life, you're not just changing behavior, you're changing life. And to me, that is exciting. It is not only something good to do, it's not just an opportunity, it's an obligation. It's our mandate to serve Missourians.